My name is Dr. Michael Miedema, Director of the Nolan Family Center for Cardiovascular Health at the Minneapolis Heart Institute Foundation. Here at the Nolan Family Center, we're committed to helping prevent heart and vascular disease by conducting research and educating people about what they can do to avoid heart attacks and other cardiovascular events. Today we're going to talk about how you can understand your personal risk for cardiovascular disease. When we talk about cardiovascular disease, we're talking about the process of plaque building up in the arteries, especially the coronary arteries that supply blood flow to the heart muscle. Blockages in these arteries are what lead to heart attacks and the need for associated procedures such as stents and bypass. I frequently say that the best way to treat a heart attack is to not have one in the first place. But in order to decide on the best prevention strategy, it's important to first understand your personal risk for cardiovascular disease. A variety of factors can increase your risk for cardiovascular disease, some of which we can change or modify, and some of which you can't. Most of the large studies that have looked at cardiovascular disease risk have clearly shown that it's a multifactorial process, meaning it's not just one thing that causes heart attacks. There are several major risk factors involved, and it's usually a combination of factors that lead to a cardiovascular event. Let's start with the risk factors you can modify. You can often control these with healthy lifestyle behaviors, but sometimes medications are necessary. One of the best things you can do for your health is to not use any tobacco products. Smoking causes plaque to build up in the arteries and increases the blood's tendency to clot. This results in blocking blood flow to the heart and brain. Much of the risk is dramatically lowered after quitting smoking. High blood pressure is often called the silent killer because there are usually no symptoms. Be sure to have your blood pressure measured at every clinic visit. For some people with high blood pressure, it's also a good idea to monitor it at home. Blood pressure does tend to increase with age as our blood vessels lose some of their elasticity. Of particular concern is the LDL, or bad cholesterol, that contributes to plaque development in the heart, brain, and kidneys and other parts of the body. High LDL cholesterol typically doesn't cause symptoms either, so ask your primary care provider how often you should have your cholesterol checked. Diabetes causes problems with metabolism and a subsequent increase in blood sugars, which can also increase plaque development in the arteries. People who have diabetes are about 2 times more likely to have a heart attack compared to people who do not. Now let's switch gears and talk about the risk factors we can't control. The most potent risk factor for cardiovascular disease is age. So while heart disease can happen at any age, the older you are, the higher your risk. While men are at higher risk for cardiovascular disease continues to be the #1 cause of death for both men and women. For women, the risk increases after menopause. Some conditions diagnosed during pregnancy, such as gestational diabetes and gestational hypertension or preeclampsia, can increase risk sooner. Many patients come to our prevention clinic because they have concerns about their family history of cardiovascular disease. A family history is typically defined as having a father or brother who had a heart attack or stroke at age 55 or younger, or a mother or sister who had cardiovascular disease at age 65 or younger. Family history is an appropriate reason for a clinic visit and discussion. However, having a family history does not make you destined to have cardiovascular disease. It's preventable. The first step in understanding your risk for cardiovascular disease is to try and consider all of your possible risk factors. This can be hard to do on your own, so several risk calculators exist to help you better understand your risk. You can use the calculator with the help of your primary care provider or preventive cardiologist. You can also use it on your own. There's a link to a commonly used calculator on our website. The calculator will ask your age and questions about several other risk factors. It will then calculate your risks of a heart attack, stroke, or dying from cardiovascular disease over the next 10 years. Generally, if you have less than 5% 10-year risk, you're considered low risk. If you have a 5 to 20% risk, we call that intermediate risk. And if you're above 20%, we consider that high risk. I frequently have patients ask me about other tests to assess their risk. There has been significant research into tests for inflammation, ultrasound studies of various arteries, genetic tests, and more detailed cholesterol studies. But the overall conclusion from the American College of Cardiology and the American Heart Association prevention guidelines is that these tests are not as helpful as we had hoped for routine risk assessment. However, there is one test that most preventive cardiologists would agree can be very helpful in risk assessment, and that test is called a coronary artery calcium score. A coronary artery calcium score, or simply a calcium score, is a test designed to determine the amount of calcified plaque in the coronary arteries. We mainly recommend this test for individuals who are age 40 to 80 years old and at intermediate risk for cardiovascular disease, meaning that 5 to 20% 10-year risk we talked about earlier. For those at low risk or high risk, a calcium score still can be considered. We should probably discuss this first with your primary care provider or preventive cardiologist. In summary, it's important to understand that your risk for cardiovascular disease is heavily driven by your age, but multiple other risk factors should be considered as well. Determine your 10-year risk for a cardiovascular event using a risk calculator. If you are uncertain about your risk, or if you're at intermediate risk, consider a coronary artery calcium score to better understand your risk and your likelihood of having heart disease or stroke. Practice heart-healthy behaviors. Adopting healthier food and activity patterns can significantly reduce risk. In fact, it's estimated that almost 80% of premature heart disease and stroke can be prevented through healthy lifestyle behaviors. Thank you for your time. I hope you found this video helpful. Here in the Nolan Family Center for Cardiovascular Health at the Minneapolis Heart Institute Foundation, education is a core part of our mission. So I encourage you to share this video with your family and friends and anyone you think can benefit from this knowledge. To use the risk calculator or for more information on cardiovascular prevention, you can visit our website. Thanks again and stay heart healthy.